Hi everyone, and welcome back to the Parents of Mouth Breathers. Today's episode is a really important one, and one that I'm really excited for you to hear actually. For a long time, I personally saw surgery as the last resort for my son, something that I only wanted to do if I hadn't, found another solution. And I spent over 2 years trying everything and constantly questioning myself along the way. What I didn't fully understand at the time was the bigger framework around sort of sleep disordered breathing and airway health. So, in this episode, I'm joined by Dr. Jessica Lee. She's an ENT who trained in the very traditional surgery focused sort of medical system, but then realised that looking only at tonsils and adenoids wasn't quite enough. She's what's known as an integrative ENT, which means she doesn't just look at whether a child needs surgery, she looks at the whole picture. So, breathing patterns, growth, inflammation, immune health, environmental factors, craniofacial sort of development, all the things that I talk about a lot on my Instagram. And she collaborates with other professionals who are also airway aware um, when needed. And she sort of works in this collaborative way with the parents as well. So, in this episode, we talk a lot about sleep disorder breathing as a spectrum, and that's the first time that it's sort of been presented to me that way. She shares with me two questions that might predict issues really early. And then we talk about surgery when it's appropriate and when it isn't. And to be honest with you, she removed some of the shame around this conversation for me because I was really gutted to have to move forward with surgery. So this episode certainly isn't about pushing surgery, but I just want it to be a bit of an eye opener to those of us who are maybe verging on being a bit too anti-surgery, and maybe sometimes it's looking at the whole child and it might just be the next best step for your child as it was for mine. So it's really about widening the lens around that conversation. So I hope you find it as sort of clarifying as I did. And I think Dr. Jessica Lee is extremely articulate, and I'm sure you'll find that she is as well. So let's get into it. Hi, Dr. Jessica Lee. Welcome to the Parents and Mouth Breathers podcast. Thank you for being here.
Thank you so much for having me, Tasha. I'm excited to be here.
So, for those who are listening, can you give a bit of an insight into what it is you do, your experience, and also for those who are hearing from you for the first time, you're an integrative ENT. So, can you explain sort of what that is?
Absolutely. So I've been in the ENT practice for about 15 years now, and I did traditional medical school training in the US and then a 5-year residency. And a lot of that residency is very surgically focused. But when I got out into practice, I started just wanting to understand more about other ways and other tools to help patients with some of the more common ENT things that we see that, to be honest, we don't have like a great surgical fix for. And that led me down, after some personal experiences, led me down the aisle of looking into more integrative medicine. So a few years ago, I did the lifestyle medicine training and board certification. So I'm now double board certified. And then I've on my own done classes in functional medicine, herbal medicine, homeopathy, just lots of different ways to try to build up a toolbox that is robust. And so if I have a patient or a family coming in and they want to avoid surgery, I don't, have to send them away. I can say, great, here's some other options we can look at. Right.
I know for the listeners that are UK based, we have a very sort of strict NHS system that takes many years to catch up with this. So I know through my experience and those parents I speak to that they go to see an ENT and it's very much through that conventional lens. So this is, really interesting to hear how you've brought all of these different elements into it. So with that in mind, if I can take you to a parent that's coming into clinic to see you, they've got a child, they've got some concerns around, maybe mouth breathing or airway dysfunction, early signs. What would you typically do when you assess that child?
I see a lot of these kids and families, and, some people find their way to me on their own or via word of mouth. But to be honest, I do get a lot of referrals coming in from dental colleagues or from like health allied professional colleagues. So that's going to be like speech therapy, occupational therapy. myofunctional therapy. And, the symptoms may not be very severe, or in some cases, the families actually don't really have any concern, but maybe, like I said, a dentist has brought up that the child has large tonsils. And so, it kind of varies on what people are coming in with. But really, where it starts is just a very good history. I often will, have the parents, go ahead and just walk me through what they're seeing at home. When do they start having concerns? How long have they noticed it going on? But the really interesting thing that I'm doing while I'm listening to that story is I'm kind of sneaking peeks at their kid and like noticing, are they breathing through their mouth or their nose? Do they sound congested? Are they constantly sniffling back mucus? Are they kind of doing this? Some young kids will do this kind of breath holding where they're quiet and then you hear them kind of, like take a deep breath. And so I'm kind of watching in the wings what's going on while I'm getting the history. And again, the way I practice, I really do like to try to maximize the time we have together to explore the whole picture. And so a lot of times I'll even go back to birth history, ask about things like breastfeeding, if that was something that they were able to do or chose to do, and how did that go. We talk about how did they transition over to solid foods. And the reason I talk through a lot of things like this is it makes a big difference when it comes to looking at the progression of symptoms, right? If someone, for instance, were to come in and say that, their child was A-OK until last month and they had a really bad sinus infection or, viral illness, and all of a sudden they're snoring, that's a very different scenario than a child who maybe had trouble breastfeeding and has been chronically congested since, the parents can't even remember when, and has had multiple recurrent viral illnesses and ear infections. And, now they're noticing restless sleep and they seem exhausted and they're snoring. Those are two very different pictures. And that definitely changes how we approach it. But
Okay.
for sure, the first place to start is with just a really good history. And then we can talk more about physical exam things as well.
One of the things you've hit on there really is there's lots of moving parts that can give, send signals and give you clues as to what's going on with the child. One of the things that obviously I try and spread awareness around is mouth breathing in particular, that this is something that needs to be looked at if your child is a mouth breather. And actually, this is something from my personal experience that when I went to see an ENT, my son was having sleep apnea episodes, and I was told in no uncertain terms that mouth breathing isn't something to worry about and that apnea episodes are normal in everyone to varying degrees and that snoring is normal. And I know that I'm not the only one that's told this stuff. So banging this drum about mouth breathing and that it's a signal to these larger airway issues. Can you speak to that? Can you give people some insight as to why it is such a concern if their child is mouth breathing and all the downstream effects of that?
I have to confess that probably when I first came out of residency, I probably said the same types of things to parents who came in with snoring kids. Because honestly, our focus in residency is very much on obstructive sleep apnea. And if it's not obstructive sleep apnea, then it doesn't need to be worried about. And the reason I like a more integrative approach is, and even with lifestyle medicine specifically, it is very much focused on prevention versus reaction, right? We're not going to wait until there's a problem to do something. We're going to look at the scenario and we're going to try to figure out, hey, are we moving in a direction that we don't want to go? And if so, how do we shift course? So, with mouth breathing, is there was a study that came out recently and they compared all of the different sleep kind of questionnaires that we use when we're looking at kids. And there are some of these that I use in clinic. But what it looked at is what were there one or two questions that very consistently predicted the presence of either sleep disordered breathing, which is kind of what we would call it when there are concerns like snoring and restless sleep and, really tired in the morning, all the way up to obstructive sleep apnea. And there were two questions that stood out as consistently in all of the questionnaires being very predictive. And one of those questions is, does your child breathe through their mouth during the day? The second question was, is there any concern that your child is falling off the growth curves? So from a, standpoint of looking at kind of overall body health, obviously that would make sense. But that struck me, because that was not something that I was taught to ask about. I was taught to ask about snoring. I was taught to ask about gasping and breathing. But a lot of kids, like you said, it's a spectrum, right? You don't start off, you don't go from 0 to severe sleep apnea. And one of the phases is going to be this sleep disordered breathing pattern. And once they start moving into a time period where they're breathing through their mouth during the day, you know that that's ratcheting up in the wrong direction.
Okay. So, with that in mind, a parent's noticed their child is mouth breathing, they have noticed other signs, they go to an ENT. What should they expect in an appointment with an ENT? What are they going to look at, and how can an ENT assist with that?
Well, I'll definitely speak to what I do. I certainly, don't want to speak for other colleagues, but what I would say that is you should expect an airway exam. And, we've already talked about history, about some of the things we go into in the past and also current symptoms. But, for the physical exam, you're going to start with basic exam. You're going to look in the front of the nose. You're looking for, is there evidence of swelling of the lining of the nose? Is there a lot of excess mucus? Is that mucus clear? Does it look like it's infected mucus? Is the child got a crusty, draining nose, right? You're going to look at the turbinates and the septum. Now, usually in young kids, you're not going to see a whole lot of septal deviation concerns. And we do see that a lot in older kids and adults. But in young kids, I don't see that as much. But the turbinates can be varying degrees of swelling. And that is a marker to me that there is something the child is inhaling on a regular basis that's causing a lot of inflammation. Again, at that age, if we're talking toddler ages, we know that kids get sick a lot, right? They get a lot of viruses. I'm a mom too. I remember that phase of life, and it felt like every time my kids got sick, I got sick 10 times worse, right?
Yeah.
So we know that that's part of their life, but what we want to see is we want to see them, once they are sick, we want to see them fully recover as quickly as possible and then go back to a very normal baseline. We get into trouble when the viral infections are back to back to back and the kids never get a chance to recover. But I also think about environmental things. So I also look at, we talk about air quality. Secondhand cigarette smoke is one of the worst things for a child's nose. And so that's always something I ask about. And even in this day and age, I am like stunned that I will still have parents look at me and go, oh, wait, the fact that I go outside and smoke isn't just enough. And I say, no, because it's on your clothes, it's in your hair. And when you walk back in and your 2-year-old jumps into your arms, they're breathing all of that in, right? So, we look at smoke exposure. We look at, could there be any concern for indoor allergen sensitivity? So things like dust. And the part of the US I live in, we're looking at dust mite, we're looking at cockroach, we're looking at animal dander. Do they have a pet dander sensitivity? Also have to think about mold exposure. I think there's some legitimate, concerns around that. But a lot of these things, that's where allergy testing can be useful.
Mhm.
So, that's the nasal exam. Then we look in the mouth. And of course, again, I used to just look at the tonsils and be like, oh, they're a size, we grade them on a size 1 to 4. 4 is what we call kissing tonsils. Now I look at where's the tongue resting? Where do the teeth fit together? Is there concern that their teeth are becoming crowded? Do they have an open bite or a cross bite? Looking at the size and the shape of their upper roof of their mouth, which is what we call the palate, looking at, the back wall of the throat. So not just the tonsils, which sit on the side, but looking kind of past them to the back wall of the throat, where we will often see, if there's thick nasal drainage dripping down, or if there's what we call lymphoid hyperplasia, where you've got this like speckling of swollen red bumps in the back of the throat, right? A lot of these, again, just kind of point to either recurrent infection or some type of chronic inflammation or inflammatory pattern. So that's the basic exam. Of course, I've already told you, I'm already looking at kind of their breathing patterns and, if there's any concern for wheezing, I'll listen to their lungs. And then the rest of the exam would include ears, neck, kind of a few other things. So I always tell parents, okay, that's our basic exam. But where I like to go a step further is to do a procedure called a nasopharyngoscopy. And so this is a procedure that, I always stop and just talk to the parents first and say, look, I'd really like to do this because this is really the most accurate way to look at your child's adenoids. So oftentimes when people talk about tonsils, they will interchange or they'll combine tonsils and adenoids. but you cannot see adenoids on a physical exam without doing a camera exam. So I always have that conversation. I tell patients and parents, I say, look, we can do this. We can work as a team. And I promise you, I can get in and get out of your nose in about 10 seconds. And it will give us like so much helpful information. Because if I look back there and the adenoids are completely swollen and blocking the back of the nose, then it makes sense as to why that child is breathing through their mouth because they are compensating because they have to, right? And so I always tell parents that it's really helpful to do that as part of the full airway exam.
There's so many things you've said there that I can personally relate to because I've been through all of this with my son. And I recently made the decision to move forward with surgery because you highlighted there are lots of different elements that can contribute to a child suffering. I went forward with the surgery and I've noticed big differences, and I'm sort of kicking myself that maybe I didn't push for it sooner, but I was really afraid of surgery, and I was afraid of the removing these tissues. What are the downstream effects? So I was very conflicted, and I know that the parents I speak to, they're a lot of times at that crossroads themselves. They don't know. So from your standpoint, when do you think it's right and good for the child and necessary to move forward with surgery? And is that, would you try other things before you do that? Or how do you generally do that referral? What are you looking at?
I first want to touch on something you said because I see and I hear this a lot. I see a lot of parents who have a lot of fear, even discussing the surgery or even considering it. But I also see a lot of parents who have kind of a guilt or even a shame sensation about even thinking about surgery. I think that there is a misconception that surgery means you have failed at something. You know, if you've tried something else before and it wasn't enough, and you end up needing to have, surgery scheduled for your child, I think a lot of parents feel like it's a failure on their part, or like you've mentioned, where, you think, well, gosh, should I have pushed for this sooner? So I just first like to say, you know, I never want a parent to feel guilty or ashamed or pressured or anything like that. So, I really think that this decision is an individual decision. It is based on not only your specific child's, characteristics, what we're seeing, their symptoms, their physical exam, but also your values and your goals. As an integrative provider, I do attract a lot of families who do not want surgery, and they are clear upfront about that. And I'm fine with that as long as we make an agreement that we're going to have, these other steps and other things we try first, but with the agreement that if the symptoms or the disease is severe enough that I would like to come back and discuss that in the future. So, this process of making this decision, like I said, is very individualized. We first have to consider what's the severity of the problem, right? If I have a patient who is, mouth breathing at night and snoring a little bit, but they don't mouth breathe during the day, they don't seem to have that chronic nasal congestion. Maybe they've had a sleep study and their sleep study was negative, so they don't have official obstructive sleep apnea. So they're kind of in this precursor category. And if that is a family who would like to avoid surgery, which in that case I would say is, not my first choice to do surgery, then, we have a lot of options, right? We have, depending on the age of the child, because that matters a lot too. There is a lot to be said for looking at nutritional health, which impacts your immune health, which in turn impacts your respiratory health. There's a lot to be said for nasal hygiene and nasal treatments. So I tell parents, even if you can just start doing a few drops of nasal saline in your child's nose on a regular basis, that can be extremely helpful to thin that mucus, keep things moving through so that the body can kind of get back to its baseline. There are obviously medicated nasal sprays that are options, and these are things that do have evidence supporting them to treat, maybe kind of that sleep disordered breathing or mild sleep apnea category of kids. And those would be cases where maybe surgery can be avoided. There also is a whole world from a multidisciplinary standpoint. There is a whole world of, dental specialists who are becoming more interested in airway and learning more about it. they're often working with, I mentioned earlier, something called a myofunctional therapist. And so there is a team approach for a lot of kids to say, okay, what is the current status? How severe are we talking about? How bad is this issue? What's our time frame? How old is the child? How long do we have, do we feel like, to work on this before we kind of need to push in a different direction? And so that's just a team discussion. And I am thankful to work in a place where I have a great group of colleagues in those other specialties. And we talk about patients, we send notes to each other, we call each other on the phone and go, hey, I saw so and so, and this is what I'm thinking. And I know not everybody has access to that, but I think it's something to look for, it's something to ask about. So, you have to think if a child is on the milder end of that symptom or disease spectrum, surgery is probably not going to be the first choice. But on the flip side, I'll give you an example. I have a family who I have been working with for a few months. We've been making some nutritional changes, some nasal hygiene changes. We've started some herbal support. And, their goal when they came in was to avoid surgery. But the child does have obstructive sleep apnea. And over time, we're noticing that we're not making the progress that we all, the parents and myself, hoped to make with this non surgical approach. And so we're at the point where I said, look, I think we need to come back and I think we should talk about, surgery. And the parents are ready and they're willing. And I think, that's where you have to just kind of have a provider who you feel comfortable. And in some cases, you do have to advocate for yourself and your child, right? You may have to get a second opinion or push back a little bit and be like, hang on, I have some more questions I'd like answered. So there's a lot to it, but I think the honest answer is it's an individualized decision making, but a lot of it does depend on, again, severity of the problem. And then that timeline, we're going to be treating a 2-year-old very differently than we're going to treat a 7-year-old as far as options available.
Yeah, and I would like to speak to that a little bit in terms of, the context of what we're working with in the UK with our National Health Service. There is, unfortunately, not as much scope for, joined up care. We don't have teams and different specialists talking to one another, which is why I encourage parents to advocate for their child and go towards a multidisciplinary approach, speaking to different professionals, which is going to require a private element. We need to think about that as parents, that is something we need to cost for, quite frankly. So when a child is on the list for surgery and they're ready to go, just like my son was, after nearly 2 years of trying alternative things, I went down the allergy route, looking at certain intolerances, saw huge improvements when we removed dairy, for example. And people, I think, thought I was a little bit wacky because I could see such a difference in his behavior in particular. When I took dairy away, he just didn't seem so explosive and he was able to regulate a little bit more. So we went for surgery and, as I outlined earlier, there have been big changes. And I just want to speak to other parents who were as dubious as I was. And I really appreciated what you said there about, trying to let go of the guilt a little bit, because I was back and forth with what was the right decision for my son. And I know now that that was the right decision. There was nothing that was going to help with that obstructive sleep apnea because of that ripple effect. This is something that had got worse and worse and worse over the years. And he was 5.5 when he had his surgery. And it was the right thing to do. And I see that now. So could you talk a little bit to what the surgery involves? Obviously, it's individual to each child, but just sort of generally speaking. And then what parents need to be doing afterwards, because just from my experience and also anecdotally speaking to other parents, surgery isn't always enough. There
Mhm.
needs to be a sort of aftercare. And I think that's where we're really lacking, particularly here in the UK. There is no
Mhm.
aftercare. I've not seen anybody 3 months after surgery for my son. There's no follow-up care. So can you speak to that, to the surgery, and then what we need to be thinking about afterwards to get the best long-term results for our children?
Absolutely. And I would say that it even starts before the surgery, meaning part of that physical exam that I mentioned looking at things like palate and where the teeth are sitting and things like that. I can often predict now, based on the kind of way I approach kids, I can often predict who might still need further therapies even after tonsil and adenoid removal. Even if we all agree that is the next best step, based on their craniofacial shape, so the shape of the jaws and the skeleton, are going to potentially need orthodontic intervention the higher and the more narrow the upper jaw, especially if they already have things like dental crowding or a crossbite or something like that. And so I think part of that discussion up front is really helpful to tell parents, this is what we need to do now at this age. This is the best thing for them. And this is going to hopefully take them down one path and start turning them to go down the other path. But it's not like you jump tracks immediately, right? It's a slow turn back the other direction. And then, depending on how close we get to that track that we want the kids on, that would then help us determine if other treatments are necessary. So I think that discussion starts before surgery is even happening. Okay, if I have a family who's decided to do surgery, I think just a really good informed consent process is necessary in clinic. So we talk through, what they can expect the day of. In my case, most of the patients are going to be done in an outpatient surgery center. So we say, okay, you're going to come in that day, and this is, how it's going to go. Your child's going to be put to sleep by an anesthesiologist, and they're going to have an IV placed after that. I'm going to do the surgery, and we can come back to some surgical technique things. But, I tell them they're going to wake up with a sore throat that they did not go to sleep with. And the anesthesia is going to still be in their system. And so I always prepare them, that first hour or two after surgery is sometimes the roughest, because as a parent, you feel a little helpless. You can't do anything to calm them down sometimes. Once kids get home, they typically do better. My general time frame is, and again, it depends a little bit on the age of the child, but it also depends on the child. So I'll often tell parents, your child best, and how your child manages pain. And, they're going to react to you. They're going to follow your lead. So, but in general, I would say that it's about a 7 to 10 day recovery. I would say that the majority of kids by day 10 are feeling pretty back to normal. But I also tell them, some kids it may take a full 2 weeks, a full 14 days. So, kind of plan ahead that it could be a full 14 days. We'll be doing good if they're, kicking things around and feeling better by about day 10. It's often days kind of 3 through 5 is a time frame where I see kids feel worse. And that's because the swelling in the back of the throat hits a peak. So, right when surgery is done, right when those tonsils are removed, there is a scab, but the body hasn't started reacting to heal that space yet. That sets in at about 48 to 72 hours. So, I warn parents, first night may not feel so bad, but the coming nights could feel a little worse. And then they'll often have a little second area of improvement, and they'll kind of dip again between days like 7 to 10. And that 7 to 10 day period is often described as a period of time when the scabs like fall off. And that's when you get into the bleeding risk. And so that's, certainly the most common things that parents need to be aware of are, pain management strategies and making sure that the kids are staying hydrated, which is critical. But the scariest part, what keeps parents, fearful, is this bleeding risk. So on average, this occurs in about 1% of kids. But if you're in that 1%, it doesn't matter, right? It's terrifying. And so we always talk through, what is it going to look like or sound like? Oftentimes, the younger kids, they're not going to tell you. They're just going to, start coughing or spit, and you would see it. The older kids may be able to tell you, hey, I taste something funny, and you look and you see bleeding or a blood clot. And the answer is, you call the doctor right away, no matter what. No matter if you think it's a little bit of blood or a lot of blood, no matter if it bled and then it stopped, you always call us, because we want to be aware, because we can help you determine, do you need to come into the clinic or do you need to come into an emergency department? What you can do kind of in the meantime while you're en route to try to, help keep the child's airway safe. And I suspect it's because when we go to sleep at night, our blood vessels naturally dilate. It's actually a recovery process our body goes through. And I think that if you have an area where a blood vessel has, the tiniest little crack in it, but the clot is holding it, and then that blood vessel dilates and gets bigger, then that clot no longer can manage that crack. And then that's when you get bleeding. So I often will tell parents, and again, this is a little bit off label. Again, I'm a mom. This is what I would do. If my kid had a tonsillectomy, I'd probably sleep in the bed with them. And that's probably overkill.
Mhm.
Or I'd at least put like a baby monitor in there because if you hear them coughing at night, you'd want to go in and you'd want to check and make sure there's no bleeding. But that's, those are the big things, right? The big thing is pain management and hydration, watching out for any signs of bleeding. There are certainly other risks and things that we do talk about. We talk about injury to the lips, the tongue, the teeth, and how we avoid that. We talk about something called velopharyngeal insufficiency, or VPI. And that is a scenario where if a child's palate hasn't fully developed and you remove all of the adenoids, you can end up having like a gap. So if this is the palate and this is the back of their nose, then you remove all those adenoids, there can be a gap. And that gap is where kids will get regurgitation of like liquid or food into their nose, and it can cause speech problems. But those are some of the most common things. The only other concern from a serious postoperative viewpoint would be if your child does have diagnosed obstructive sleep apnea and it's moderate or severe, there is a risk of a type of problem breathing the first night after surgery. So a lot of those kids are actually kept in the hospital and they're observed overnight. And it has to do with when you have such a severe obstruction and you take it away all of a sudden, the body and the lungs specifically continue to pull hard to get that breath in, and it can actually pull fluid into the lungs temporarily. And that's very, very rare. But again, that would be something to consider if your child has a higher level of obstructive sleep apnea.
Okay. Yeah, unfortunately in the 1% group, because my son did have a bleed 10 days after, and luckily I was in the room with him.
I'm a mom and I can't argue. I would do it too.
Yeah. And and I don't want to sort of be off-putting to other parents. Naturally, it was scary, but I feel as though I was prepared for anything. I was so, diligent in those weeks after surgery. And we had to go into the emergency room, and he was kept overnight and sort of assessed. And their theory was that he had been swallowing these blood clots, and he effectively vomited it all up. But it was like a
Yeah.
projectile vomit.
Oh.
But everything settled afterwards. And as I touched on earlier, I suppose I don't want to understate, just because there's still ongoing issues. I want to give credit to how effective the surgery has been for us. He had a tonsillectomy, an adenoidectomy, and also he had grommets fitted.
Mhm.
And it makes me really emotional thinking about it, because he came out of surgery and he was really overwhelmed, and he was like, "Mummy, my ears, they're whistling. My ears are whistling." And he could hear things that he hadn't heard. And if I look over the last 3 months, I've had a different child. There was a before and there's an after. And it's really great to see things like his appetite is much better. He's had a growth spurt. He's still within the brackets of what they would expect his growth to be, but he's on the lower end. But he's noticeably smaller than his classmates. And he's had a growth spurt. He's fitting into the clothes of his age range. He's more energetic, whereas he used to be really tired and stuff, in especially dip in the afternoon. And he just seems like he's coping a lot better. And so even though it was frightening to go through it, and then obviously with the bleeding and whatnot, all of these after effects have ultimately improved my child's quality of life, and ours as a downstream effect of that. There's no doubt in that. And I think I want to speak to just how all consuming this has been over the last few years of our lives. And other mums that I speak to as well, we relate we become sort of obsessed with it. We notice there's something wrong with our child's airway, and we want to do something about it, and we're obsessed with it. And surgery it's not a failure, as you say. It can be a life changer, and for us it certainly has been.
Absolutely.
Yeah.
I hate that you were in that 1%. I mean, trust me, as a surgeon, I, you know, I track my own numbers and I look at complication rates. And I am always very pleased when my rate, yearly rate is less than 1%. It makes me feel like I'm doing something right, but it doesn't mean it's zero. And I just hate it. Like I hate that feeling that I get as the surgeon, knowing that a family had to go through that. But again, I think what you said is important, that as long as there's proper preparation and there is an expectation of, okay, if it happens, here's what you do, and you have a plan. And I also want to mention, you touched on your child's growth spurt. And that goes back to, I mentioned there was the study that looked at the two questions that were most predictive, and one of them had to do with growth curves. And it's amazing to see. I will tell you, I have a child who also had some airway concerns and didn't end up needing tonsillectomy, but went through a different pathway. Same thing. When he was done with treatment, he had this. I mean, we just measured him. I was like, you grew 4 inches last year. Like, what is going on? So it's like you don't notice it until it's corrected. And then you're like, oh my goodness, this is what your body needed. Right.
Yeah.
Absolutely.
So, how can parents like myself post surgery be looking at working with whether it's the ENT continuing with ENT treatment and other professionals in a post surgery situation?
Yeah, I think the best thing to do is to just ask, even before surgery. When you meet the ENT, ask, do they collaborate with dental specialists? Are they aware of, orthodontic treatment options for sleep disordered breathing or for, difficulty with nasal breathing, mouth breathing tendencies? Ask if they work with, any type of therapist who work on oral, motor, and tone and strengthening. And if they don't, it doesn't mean they're a bad surgeon. They can be an excellent surgeon, they just don't have that connection yet. And I do think, I'm not naive enough to think that that's commonplace. I think that's rare. I think that the division of medicine, at least again in the US, we have dental insurance and we have medical insurance, and it's weird. And it's so siloed. And it's really only been in the past several years that I have, realized the amazing benefits of having that connection. So I think you just have to kind of search for it. You may not find it in your hometown, but you can then say, okay, well, we trust this surgeon. And then, I need to find another, orthodontics or, dental specialist who I also feel like I trust. And even though they don't talk together, or maybe they will, maybe you can encourage them to. I think you just have to ask. And that's part of kind of advocating for yourself. And there, of course, your podcast and your platform, I think you're alerting people and again, helping spread that awareness that this is a possibility. And I think that it gives people places to look, if they're saying, well, I don't have my functional therapist in my town, but, let me go look and see, who did so-and-so work with, and they had a good experience. And, you obviously want to look at credentialing and things, but I think that you just have to, there's a little bit, I hate to say it, but there's a little bit of work you have to do on your own part to put that team together.
Yeah.
Yeah.
I listened to an episode you did. I think it was an Instagram live that you did a couple of weeks ago. The doctor's name escapes me.
Dr. Kilbane, Sheila Kilbane.
That's it. And
Yeah.
you talked about this sort of, there's a growing body of research around gut health and its connection to airway health. Can I invite you to sort of share a little bit about what we're seeing there and why us as parents should be interested in looking at that?
We talked about how for a lot of kids, the reason they're so congested, the reason the adenoids and the tonsils are so large is because of this recurrent viral illness pattern. And some of that is going to be exposure. And certainly kids go through phases where we expect that. And it's part of how their immune system learns. And that's completely normal. But if you are trapped in that cycle and they're not outgrowing it and they're not getting stronger with each infection, right? Then you have to start considering that maybe the immune system isn't functioning as optimally as it could or should. And we know that there is a very strong gut immune link. I think the statistic is like 70% of our immune cells reside in our gut. It's how we fuel our body, right? It's how we get our nutrients that are often sort of what we call cofactors for all of the cellular processes. And that's going to include things like white blood cell function and production of immunoglobulins and, inflammatory pathways. And so if a person isn't fueled well, then it makes sense that their immune system may not be functioning as well as it could. And so that's where then we talk about the respiratory piece of it, where if your immune system isn't as robust as it could be, you are more susceptible to viral infections. And when you do get a viral infection, maybe you're more susceptible to it turning into a bacterial infection. And, when you do get the bacterial infection, do you recover, very quickly and you bounce back, or are you sick for weeks at a time, right? Those are all clues. And so that's where gut health comes into the discussion for me in my clinic. And again, with the training I've done, I feel comfortable approaching the topic and making recommendations. I don't know that all medical professionals would, but you can also, look for registered dietitians and nutritionists to work with as well. But what I like to talk about is, especially in the world of kids, right? And we're busy moms, and there's a lot of on the go, and there's a lot of on the go snacking. And when you really start boiling it down and you look at, the proportion of, for instance, processed foods to whole foods, even that very simple balance is out of balance for a lot of kids. They get a lot of prepackaged yogurt in the morning or a frozen breakfast item. They go to school and maybe they get goldfish at, snack time. And then, lunchtime might be pizza and chocolate milk. And then, they come home and they have a, fruit gummy, or something like that. And then the evening is, maybe they get a vegetable that evening or a fruit. And it really does make a difference, right? Because those processed foods, they're low in nutrients. And again, nutrients are going to be necessary for your immune system to function well. So I do have that talk with parents. And it is, again, here's a time where I stress so much that this is completely non-judgmental. I am also a parent. I have fed my children processed foods. No one is perfect,
Mhm.
but we just want to try to figure out where can we make changes? Where can we start incorporating more fruits and veggies? Some whole grains, beans are great, nuts and seeds. Of course, if you have an allergy, that's a different story. But how can we incorporate more of that and let the processed snack be, a fun treat, right? Or let the ice cream be a once in a while instead of a daily presence. But it makes a difference. And you had mentioned specifically dairy, and people ask me about that a lot. And I do explore dairy restriction with some kids. I do find it can be extremely helpful for some kids, but not every child. And so it is always a very specific, time frame where I say, okay, here's how I want you to do it. And if we're missing out on the calcium or the protein from the milk, here are some substitutes that I want you to use in the meantime. And at the end of that trial period, if you have not noticed any difference, we're not going to continue it because it's not the magic bullet for your child, right? And that is the case. I mean, I have kids who have avoided surgery by removing dairy and doing some other things. And then I have kids who it didn't make a difference. And so some of that is a little bit of a trial and error.
I know that you touched on earlier that when you bring somebody into clinic and you go through sort of a questionnaire, one of the things you might look at sometimes is their birth. Was it an emergency C-section? And I just wanted you to touch on that briefly. In the case of my son, I feel as though there was some link there. He was delivered via emergency C-section. He was exclusively breastfed. And so I was really surprised to see a lot of these signs manifest themselves. I am very over the top with, everything from screen time to the food they eat. Anything with more than one ingredient, I'm just dead against it. Although since I've gone on to having my third child, things have loosened up a little bit. But generally speaking,
Right.
yeah, generally speaking, I tried to follow it by the book, and still we saw these issues with the whole birth thing and how a child is delivered it into the world. I recently read something that talked about when they are delivered through the vaginal cavity, they're coated in whatever it is that helps with their gut microbiome. And so I'm assuming that, they don't have that when they're delivered via emergency C-section. So can you talk to that a little bit, why you would ask specifically around the birth?
So, it's not a cause and effect, but it's more of what we call kind of these correlations. It doesn't mean if you're exclusively breastfed, you will not develop allergic rhinitis or asthma, right? It just means that we notice trends. And from a trending standpoint, we then start to look at, well, what would be the mechanism? Why would that be beneficial to that group of kids? And so, like you already demonstrated or talked about, vaginal canal births do allow exposure to a microbiome that seems to be more beneficial compared to kids who are delivered via C-section. I did read something extremely interesting that I think in some places they are doing swabs. So mom's vaginal fluids are being swabbed into child's airways at birth. I don't know specifics, but I think that's fascinating. And, again, that's a way to try to say, okay, in cases where we have to deliver via C-section, what can we do to kind of minimize the kind of downsides of that? But yeah, so C-section versus vaginal birth is one thing. Exclusively breastfed, we know that mom's milk has not only inflammatory, protective kind of aspects to it in those first few months of life. The mom actually passes some of her antibodies over to the baby. But there's also other things that have to do with, again, the skin to skin contact and microbiome. We look at things like colostrum impact and things like that. All of these things, and really the makeup of the breast milk, if you think about it that way, can be really beneficial. It doesn't mean that if you formula fed your baby, you're a terrible mom. Like, again, I hate the dichotomy of like, this is the only way, and if you do it this way, you're doing your child harm. Absolutely not. A fed baby is best. And if you are unable to breastfeed, right, then formula feeding is a very good alternative. And the formulas we use nowadays are nothing like they were in like the 80s. Like, things have changed a lot.
Mhm.
So that's another one I ask about. I ask about pets in the home. It's actually, we're learning more and more that early exposures to things like animals, and then you've heard probably a lot in the news about like early peanut exposure, are actually probably more beneficial. So again, I don't like being very restrictive with little infants because you actually want them to get some of those food exposures. Now, again, there are cases where a child may have like a milk protein allergy or an egg allergy, and you have to avoid that food. But in most cases, you kind of want their exposures to be broad, but you want them to be a little bit measured, not like an avalanche.
Mhm.
Right? We haven't really touched on this, but
Mhm.
I will tell you that the other thing I do in clinic when I'm doing an airway exam is I look at the parents because genetically speaking, there are going to be people who look like their parents. And if their parents have very tall, narrow, lower faces, there's a good chance your child's going to develop that way, even if you quote unquote did everything right.
Mhm.
Right. So, that plays a role too. So I'll ask about family history of what were called atopic diseases. So that's things like asthma, eczema, allergic rhinitis. I ask about eczema, did they have a lot of eczema as a baby? Did they have a lot of ear infections, in that 2 to 4 year old range? So all of these things are just ways for me to kind of stack where do I think they are on this spectrum of like immune system maturation, and how well is their body dealing with being exposed to a world, right?
Okay, well, that was really, really interesting. So, if is there anything that you would like, if there's one thing that a parent takes away from this conversation between us today, what would that be?
Well, I'm first so glad that you have come out the other side of it, thankful that you decided to make that decision to go through a surgery. I mean, I'm glad it was a positive experience in the long run for you. I think what I would like to leave, parents and families with is that it is okay to advocate for your child. I think a lot of people feel brushed off or dismissed, and that you should ask questions. Like, you should absolutely ask questions, write them down, because again, I'm not sure how your visits are, but in the US, our visits are very short, unfortunately, and it can be hard to remember what's on your mind. So I always tell parents, write your questions down. We will go through them. If we don't get through all of them in one visit, we can schedule a second visit, right? But, advocate for your child, absolutely. And go into the discussions with an open mind as to the options. I think that it's hard when people come in with a preconceived idea about a treatment. And even if I present, sort of evidence to the contrary, it can be hard to change people's minds. And that's not something, it's not my job to change people's minds, but it is my job to do what's best by your child, and that's what you're coming in for. And again, I don't think it's not a matter of stubbornness. I think most parents, well, all parents want what is best for their child. And as long as we're speaking the same language and we're keeping that the focus, then I think as we discuss treatment options and risks and benefits of different pathways, then it's a much more successful and kind of productive conversation.
Thank you.
Yeah.
Where can people find you?
Well, I have my own business online. It's an online kind of educational format called Integrative ENT Health. And that's just Integrative ENT Health, all one word.com. And then I am on Instagram and Facebook. So on Instagram, I am at ENT Chat. The Facebook handle is the Integrative ENT Health handle. But I do try to post, I will upfront say I see adults and kids. And so you will see a mixture of content on there. But I try to do some things where it's, thought provoking questions, but then also some educational things, action items, things you can take home, things you can take back to your medical team and ask about. Just have found it really rewarding as people reach out and say, I struggled with this for years, or this is exactly what I thought, and you've confirmed it for me, or I took it back to my doctor and they agreed, so it's just really a rewarding thing to see, like you have when people reach out and you just are able to connect to people that you wouldn't otherwise get the chance to connect with.
Yeah, definitely. And I really encourage people to take a look. Your Instagram in particular has been the place that I've learned so much over the last few months. I think maybe summer of last year is when I landed upon you, and so it's very insightful. So I would definitely encourage people to do that. So thank you
Thank
for
you.
your time today, and I found it really insightful. And I'll put all of the links in the description.
Great. Well, thank you, Tasha. This is great. I love having these conversations. So thank you for having me on.
Me too. Thanks so much. Bye.
Bye bye.
So that was Dr. Jessica Lee. And honestly, conversations like that are just why I started this podcast, not to sort of tell other parents what decisions to make, but to make sure that you have the full context. Because that's what I felt like I was really missing and have been throughout this whole journey with my son. Airway health isn't binary, it's definitely a spectrum. And I think Dr. Jessica Lee really opened up the conversation around that. And whether your path involves nutritional changes or myofunctional therapy or surgery like mine did, you deserve to understand the bigger picture. So if this episode resonates with you, please do consider subscribing or sharing it with another parent who might need it. There's a lot of us going through this and trying to sort of piece it all together and find answers. But as always, trust your instincts, take what works for you and just sort of ignore the rest. You know your child better than anyone else. And I just hope this gives you a little piece of the puzzle. So I'll speak to you in the next episode. Bye.